Hello and welcome to Growing Garden City. It's Thursday, April 2nd, and we're your hosts.
Hello.
Hi, everyone.
We got Derek and Janene here with us tonight, and I am Kent Williams. So, how are you guys tonight? How we doing?
So far, so good. I allowed my parents and brother to come over for my son's birthday, and I've spent the last 48 hours wondering if that was like a huge mistake or not. But other than that, things are good. Had to go to Walmart too today, so I guess nobody's really in like a safe haven right now. Everybody's sort of waiting out different 14-day periods at a time when you expose yourself.
Exactly. So it was Doc who had a birthday. Is that right, Derek?
Yeah, he turned 4 on the 31st. Big guy now.
Happy birthday, Doc.
Happy birthday.
So you're down in Arizona. How's the weather, Derek? It's really cold in Garden City, Kansas right now. Looks like we got a cold front moving in.
It's been 85 here for the last day and a half. And it's starting to heat up. Like we finally shut our windows and turned the AC on, basically. So it's the pool's still cold though. You can't get in the water yet.
So Janene, I'm sure you've turned on the heater and not so much the AC right now here in Garden City. It's awfully cold outside.
So I still have the air conditioner on. I run the air conditioner all winter long. Husband asked me to, if we could at least set it to a temperature that, you could hang meat in the living room, because I'm freezing everybody else in the house out. But actually going to be a lot warmer day outside. I thought it was supposed to be 67 or something, and then I went outside, and that wind has a bite to it.
It definitely sounds like spring's on its way after this cold front moves through, so we're looking forward to that. So moving on with the show tonight, we've got special guest Maggie Unruh with us later on. She's going to come on and talk to us a little bit about what's going on at Finney County Health and some ways to help prevent the spread of COVID-19. As of April 2nd, today, the state of Kansas is reporting 554 confirmed cases of COVID-19 and 13 deaths related to the disease. According to the KDHE, 114 people have been hospitalized and with confirmed cases of COVID-19, and 5,411 negative tests have been reported so far. As we know, on March 28th, Governor Kelly issued a statewide home order stating that all residents should stay home unless performing essential activities such as obtaining food or seeking medical care. The order went into effect at 12:01 a.m. on March 30th, Monday, and will remain in place until at least April 19th. So we're all dealing with the stay-at-home order right now. Janene, how are you holding up with that? I understand you're still working.
Yeah, I'm working remotely at home. Some are better than others. I don't deal real well with not being able to see other people and be able to visit and talk to people. So it's definitely going to change. I'm thankful for video conferencing and being able to do that. It's been kind of tough. So
yeah, absolutely. A lot of us have kids at home too, with school activities going on right now. My kids have actually kind of enjoyed it. The first day into it, they zoomed through the few courses that they had, and we're just dying to do more. So I think it's been a pretty good success so far. The teachers seem to be handling it well. I like the curriculum, the YouTube videos, and our teachers have done snacks with the teachers, or breakfast, lunch with the teachers, coffee with the teacher.
Cool.
Yeah, so they're still interacting through Zoom as well. I think that Zoom is huge for us. How long has Zoom been around, Derek? Do you know?
It's been around for a while, but they're actually taking a lot of heat right now. Everybody jumped on it in the last month, and people are saying not to use Zoom anymore because apparently they're selling all your goods. They got caught selling everybody's goods and signing into people's Facebooks and stuff like that. But yeah, it's been around for a long time. It's a godsend for people if you don't mind people snooping through your stuff. There's a bunch of different options. Right now, we're using a program called StreamYard, and it's a good way to get a bunch of people together also. But yeah, it's crazy. I've been on the phone all day the last 3 days with different people that work for like I today was working with a lady who's a accountant. She types up what they say in court, whatever you call that, and they're doing. Imagine this: they're doing court on this now. Like this is how they're doing court in Dallas, where she lives, and so she had an audio nightmare figuring out how to. So I was on the phone with her for an hour and a half today, setting her up. So I've been really busy with gigs like that, just teaching people how to use this stuff. So a lot of people are definitely using it.
Yeah, Google Hangouts has also been around forever. It's like that old forgotten friend. We might all end up back on that thing. Hopefully they make it a little more user-friendly. Zoom's been kind of cool, though. I like the way you can move things around. It seems pretty interactive as you're talking as well. Yeah, so, just hanging out here during the stay-at-home order with the kids, doing some outside activities. I'm thankful, for the teachers. The PE tasks have been pretty cool. So we get outside and everybody just, jumps over a line or the burpees have been crazy with my older son. So we're all participating in everything. So it's been cool around the Williams family. Something else, have you guys seen those viral Facebook posts that have gone around here lately? The I Spy Something Blue or the landscaping ones I thought were really cool. A friend of mine made a comment on one of my posts that, people from Kansas are just proving they've been to the ocean.
Yeah.
That's a great way to be able to promote that positivity and, get people's minds off of things and just kind of look for some fun to be able to do.
Absolutely. So, before we get started, we have a quick little video from the governor that explains the stay-at-home order, and we'll play that here real quick, and we'll get right back. There it is.
Virus here in Kansas. We've requested a federal emergency disaster declaration so that we can access additional resources. We temporarily prohibited mass gatherings of 10 or more so that we can continue to flatten the curve. We're actively exploring additional private sector options to help us scale up our testing capacity as quickly as possible. These decisive but necessary steps have absolutely helped slow the spread of the virus, but unfortunately, they're not enough. Our projections continue to suggest that the number of confirmed positive coronavirus cases in Kansas could reach as much as 900 over the next week. Positive cases are appearing everywhere at this point, not just Johnson, Wyandotte, and Sedgwick County. This week, we also saw our first confirmed case in Gove County in northwest Kansas, and we expect to see more in the days ahead in these areas. Therefore, this morning, I am announcing the difficult but unavoidable decision to add Kansas to the list of 22 other states that have issued a temporary stay-home order. By Executive Order 2016, Kansas will establish a stay-home order in conjunction with the Kansas Essential Function Framework for COVID-19 response efforts. This will take effect at 12:01 on Monday, March 30th, and last at least through Sunday, April 19th. I reached this decision in close consultation with the State Health Department, the State Emergency Management Division, and our local and federal partners. And today I'm going to explain to you why I took these steps now and what it means for you, your family, and your business. First, we're going to help provide more consistency and stability across the state. As we speak, well over half of Kansas's population falls under a local stay-home order of some kind. Even
That's a lot of
Obviously,
people.
we can't play this entire video. It's like, but we will post the link to that video in the chat. But this is like the real deal now, Kansas. You're being told to stay home as opposed to just you should stay home.
Yeah, I think the ultimate goal here is, so that way when we do hit a rush of people, there's a hospital bed there for those who are sick. So we're being told to wash our hands, stay 6 feet apart, cough into your elbow when you sneeze as well into your elbow, and social distancing, which has been kind of hard. Once you're told to stay inside, you really want to go outside and do stuff and gather around people. We've been on the Tally Trail and out walking the dogs and whatever else. People seem to be doing pretty good, moving to one side or the other. Out on the Tally Trail, but we're also seeing some churches, some are more modern and doing the live feeds for church on Sundays, and we're seeing others that still have their doors open, and there's been some issues in the public there, as far as social gatherings go. And so anyway, we thought we'd bring in Maggie Unruh, who is the community educator for Finney County Health Department. Hi, Maggie. How are you tonight?
Hey, I'm good. How are you doing, Ken?
I'm doing great. Thank you for joining us. So can you tell us a little bit about yourself?
Sure, absolutely. So I'm Maggie. I'm the community health educator for Finney County Health Department. I grew up in Garden City, went to school at Emporia State University and studied communication, and am back working for Finney County and loving it.
That's awesome. Finney County is a great place to be, I think, and we're happy that you came back and continuing great traditions, especially at the Finney County Health Department. So the Finney County Health Department is what's it set up for? What's your guys' target clientele? What's your demographic down at Finney County Health Department?
Yeah, we do a lot of things. From the employee clinic, which services Finney County employees, to our community clinic, which has things like immunizations. We do STD checks and testing. We do just general consultations a lot of stuff. We really are for anyone in the community. I think that's an important thing about the health department, that really we want to serve everybody in Finney County. And so, we have a lot of services like that, both for the community and employees of Finney County.
So you guys have been designated the call center for COVID-19 testing. I'm sure you guys have seen a busy phone here lately. I've heard people have had issues getting through, so I'm sure it's just been blocked up, and you guys have stayed busy there.
Yeah, absolutely. So we've been working with the St. Catherine's emergency room to kind of man the phone together. We've kind of taken it during the work hours, and they take it at night. And so that's a really good partnership. Like, it's awesome that we can have such an awesome relationship with a private entity and really partner for the good of our public health. And so, that phone line has been super busy. It's a great place to go and just get general information from a pre-recorded message that we update as new information comes available, but also perfect to have nurses screen your symptoms. And you're right, it's been swamped. And so if somebody calls in and they can't get in, they should call again as phone lines become available. We've got an awesome group of nurses who are manning those phones and standing by to screen callers.
So when you call in, you get to talk to a live nurse. It's not just a bunch of people that we've hired in a call center to take calls.
Yep. You're talking to a live person in Finney County who knows the situation here and has the medical knowledge to screen you and give you health recommendations based on symptoms and other factors.
Okay. So for those of us that don't know, what is COVID-19 and how does it differ from the flu or common cold?
Yeah, so kind of a few things. So technically the flu and COVID-19 are both forms of coronavirus. The kind of difference with COVID-19 is that it's a novel virus and we have no antibodies against it. And so scientists have studied things like the flu or the common cold for decades, but because this is a novel virus, this is new, we don't really know a ton about it. And in fact, like researchers and doctors are learning more about that every day, which is why information is changing so fast. I mean, multiple times a day. And so with COVID-19, as you see in that graphic there, like the main symptoms are that fever, cough, and shortness of breath, which there's some overlap in symptoms with the flu and common cold as well. And so the big indicators in particular that the CDC looks for when they screen are that fever, cough, shortness of breath, and most recently, the loss of taste and smell. And so when we think about symptoms, symptoms from a cold peak anywhere from like 2 to 3 days after you contract it, where the CDC's research indicates that COVID-19 symptoms show up anywhere from 2 to 14 days after exposure. So that's a much longer period. There are also some differences with the flu and COVID-19 when it comes to like big things that matter, like the death rate. So the death rate from the seasonal flu is about 0.1% in the United States. And studies are still pretty preliminary on this, but studies suggest that the death rate of COVID-19 is going to be much higher than that, with estimates around 2% on average, which is 20 times more than the seasonal flu. And there are a lot of reasons for that. But something huge to note is that with the flu, with this common seasonal flu, we can treat it with antiviral medication like Tamiflu, or also like a preventative flu shot. And we don't really have anything similar for COVID-19 at this point.
So shelter in place is basically our only defense against COVID-19 at this time, right?
Yeah, that's the best one for sure. Staying
right. And we're supposed to wash our hands, and as mentioned, coughing to our elbow helps prevent spread as well. What other measures can be taken?
Yeah, those are all really good ones. Another important thing, Governor Kelly just released the stay-at-home order, and, they have this list of essential businesses, and with that there come essential workers who are required to go in, and we're grateful for those people. And there are things that you could even do to take precautions on that too, like washing your hands when you get to work and right when you get home when you leave, and cleaning all frequently used surfaces regularly, or avoiding using other tools or desks or phones or equipment of other employees, and just using your own equipment in your own workstation as much as possible. But really the biggest one, and I think that the governor's order indicates this, and it's kind of the message we want to drive home from the health department, is to stay home. Like, that's the best thing, not only to risk exposure to you, but also to risk spreading it around the community as well. Staying home is kind of that key.
Well, if I'm out and working somewhere, when I get home, should I leave my shoes and clothing outside, or should I take it inside? And what recommendations do we have there?
There are recommendations that have been coming out too, that it's good to take your shoes off outside your house before you walk in. There's research currently being done as to how long it can live on different kinds of surfaces. Like I said earlier, it's a novel virus. This is all new. Like, we're starting from scratch when it comes to this research. And so taking your shoes off before you go inside, if you are a person who comes into contact with a lot of different people, like once you get inside, immediately taking your clothes off and putting them in the washing machine and washing them right away is really smart too. And maybe even, if you're somebody who's in a high traffic area, doing that before you go in and hug your family or kiss your wife or your husband. So doing those kinds of things are great too. And the same, cleaning measures apply to your home also. Frequently clean your areas. When you get home from work, wipe down your cell phone, wipe down your keys, wipe down your steering wheel before and after you use it. I think there are a lot of surfaces that we don't realize that we use as often as we do, but all of those kinds of things that leave that house with you and that you come in and touch before washing your hands, it's important to take a moment and pause and think about that for you.
A lot of communities have said that they had people coming in with symptoms way before we started testing in the United States and stuff. Is that true in Finney County? Did you see anybody with these types of symptoms since like December, or is this all like brand new?
This all kind of came around flu season, and so that's the hard part where there is overlap in these symptoms. And unfortunately, not only in Finney County, but across the United States, there's just been such a high shortage of tests. And like as we've gone on, the different requirements or the different criteria for receiving a test have honestly gotten a lot tighter. And so that means people with symptoms won't receive tests, which is why that stay home is even more important. Just because you're symptomatic doesn't mean you can get a test by KDHE criteria. People experience these symptoms all the time. And it's best to stay home and self-monitor those and call the hotline and let them know of those symptoms.
With the increasing number of tests that we're supposed to be getting and that they're distributing now at the states, do you see some of those KDHE criteria for getting tested? Do you think some of those will loosen up a little bit as we get more ability to be able to test more people?
Yeah, I don't really want to make assumptions with that.
Sure.
I'm sure that I think there's like a couple of things that come into play with testing capabilities, both the supplies needed to test, like the testing kits that we receive, and then also the time it takes and the like manpower it takes in order to be running those tests. I think that's a large portion why KDHE has had to restrict too, is just they've been inundated with tests as it spreads across Kansas. And so that overwhelms their laboratories as well. And that's the same for even private labs too. It takes a long time for us to be getting our results back once we're into tests. So I think even with the increase of testing supplies, that's still another consideration that has to be made. Do we have enough people and the capacity to run a larger number of tests too? I think there are multiple things at play.
And we do have a clip from Dr. Lindsay Barnes, which we can play right now, Derek.
Testing is still incredibly limited. And I can tell you from the Finney County Health Department, we've tested 12 people that we've resulted back. 5 are still outstanding tests. The hospital has 37 tests that have resulted. 19 are outstanding. And Kearney County, I understand, has 8 that they've resulted and 8 that are still pending. So I give you those numbers to help understand that we indeed are limited, and we are limited due to supplies. We are limited due to criteria, and that is a state mandate from KDHE.
So as of March 31st, there's been 63 total tests in Finney County, and it sounds like 16 in Kearney County, with 5 positive tests resulting in Finney County. Can you answer if those were from outside Finney County or if they're local transmission now?
Sure. So, with each positive that we receive back, there is a disease investigation that happens as a result, where we contact potential people who have been exposed. And so right now, we haven't been able to completely determine the nature of those cases. And as we continue to do contract tracing to sort that out, we'll be able to identify that. But right now, neither of those things are confirmed.
So with contact tracing, can you dive in a little bit more? At the town hall this recent Tuesday, Dr. Barnes mentioned a lot about contact tracing being implemented through a state tracking system. Can you talk more about what qualifies a person under investigation? What types of questions are being asked?
Sure. So a person under investigation, a PUI, is anyone who has been tested, whether they've received a negative or positive result, and whether or not we've gotten that result back. You're a person under investigation if you receive a test. And so what we do with that is the contact tracing looks like working with those patients who have received a positive diagnosis to contact people in their household, to identify people they've been with over the past couple of weeks, where they've been, if they've been in public areas, if they've traveled at all, where they were employed, if they work in a particular department, or if there was travel associated with that position. And so it goes through a state tracking system where all of that data is entered in, and all of that is run like in collaboration with the KDHE. And so they have some mandates for that when they work on making those kinds of contacts. We work with those contacts to monitor their symptoms, to have them, check their fever, see if they're experiencing shortness of breath over time, and then that like self-isolation piece while that's happening too. It's kind of a lengthy process. It's complex because with each contact, there's another contact, and so on and so forth. And so we have an awesome disease investigation team through the health department here locally that works with KD to contact those people and to put them into that state tracking system.
We do have a comment. They're basically essentially asking if they have severe asthma, would wearing a mask outside be a good idea?
So a few things on that. One, I would recommend that you stay home, as I would make that recommendation for everybody in Finney County. That is the public health recommendation. I know that there are essentials to go out and get, and that would be the only instance in which you should be leaving your home. But the second thing is, as of right now, KDHE and CDC do not recommend masks for people who are not experiencing symptoms of COVID-19, both because of a mask shortage, but because there's not been any data to prove that they're incredibly effective. And so to this person asking the question, I would say, because you are at a higher risk for contracting COVID-19, take those precautions to stay home. If you can send somebody else to the grocery store, send them to the grocery store. If you can order your groceries online, do that kind of thing. But those would be those precautionary measures that I would recommend, as I would recommend for everybody else.
One more comment. Caitlin Guthrie says, is there any level of false negative outcomes happening?
Like us getting tests back that are negative and then turning out to not be?
I guess either vice versa, like just tests that are malfunctioning, I guess would be the question.
That's a really good question. Not to my knowledge. I think that we have a good system. I mean, not a perfect system, but a good system set up with KDHE. And, there's always that kind of fallback precautionary measure that you should be self-isolating anyway. And you should be monitoring symptoms. And so like the KDHE recommends, if you're in self-isolation and experiencing symptoms, whether you get a positive test or a negative test back, because remember, people with symptoms might not receive tests, to self-isolate until you're fever-free with no fever-reducing medications for 72 hours. And so even if you got a negative test back, or even if you were experiencing these symptoms and never got tested because you didn't meet this criteria, you should still be self-isolating until you are no longer experiencing those symptoms.
Is it like let me ask you this, like every day I get on the internet, about 3 or 4 times a year, I read that somebody cured cancer. Like, oh, this person in this country cured cancer. Oh, awesome. But then somebody I know dies from cancer 6 months later. And so every day you hear things on the internet. You don't know if it's true or not. And one thing that I see is that you have a lot of these private companies saying they can make so many thousand tests a day and ship them out. You would think that it would be like paramount to get everybody tested to see how, like, so my question is the lack of testing, is it simply just we don't have access to those tests that people are claiming they have, or is a lot of bureaucratic tape that you have to go through in order to start testing people?
Yeah, I mean, either of those things could be a possibility, I suppose. I think the fact is that there is a massive shortage of testing supplies. And I think that through, there are a lot of private entities and a lot of people looking to make money and so on and so forth. And, I think having that trusted source of the CDC and locally for Kansas, the KDHE, is really important. And so I would want to fall back on what their recommendations are and what their approved testing procedures are, as opposed to buying some random kit from somebody off the street because they tell me it's going to get me a positive or negative. Especially since we're now at the stage where you should be staying home regardless of a diagnosis, because A, it's mandated by the state government, but B, it's the best way to reduce the spread of COVID-19.
So who are we prioritizing? Who are we prioritizing right now for tests? Is it just healthcare workers, first responders?
Sure. So we follow KDHE's criteria. And so, you mentioned earlier that changed recently in the past week. And so that includes healthcare workers and first responders who are symptomatic. If there are potential clusters of unknown respiratory illnesses, and they're prioritizing long-term care facilities and healthcare facilities. So if there is a cluster of people, several people who are experiencing these respiratory illnesses and there's no other diagnoses, that would be one that would be prioritized, or hospital patients with no alternative diagnosis, as well as individuals who are over the age of 60 who are symptomatic. And so, so those are some of the KDHE prioritization process. And as a public health entity, we follow that process, simply because even if we wanted to test somebody for the heck of it, they would not run that test if we did not meet their criteria. And so it's important for us to follow along this process that they've established too, especially since there's such a shortage of test kits. We wouldn't want to waste one on a case that wouldn't be able to be ran in the lab.
So are you recommending that places like Walmart and Dillon's, even rest homes, take temperatures constantly of employees, patients, things like that, just to monitor that, since there isn't tests, and if they are running a fever, I'd assume that'd be the highest indicator for tests. Are they isolated, specifically at a rest home, away from everybody else, or how's that working?
Yeah, so I think there are kind of several questions there. First, when we talk about the rest homes, from the beginning of this, we knew and had been established that that is a at-risk population. And so we met with the leadership of those rest homes as a health department. Dr. Burns spoke with the medical directors, and they also have a lot of industry guidelines as well, independent of that. And so some of those measures that were recommended have been taken, like limiting visitors significantly or to none at all, and doing some of those screening on employees, like taking the temperatures. A lot of organizations in Finney County have already started taking those steps. We've made recommendations like that to some large employers, and a lot of county departments actually are doing that with their staff or people who enter the building. You take the temperature before you come in, and if you have a high temperature, you work from home or you go home that day, since that is kind of such a key indicator of COVID-19.
Yeah, that no visit in the nursing home is such a tough thing, I think, particularly for a lot of families that want to see their loved one in there. But then when you look at the hospital, they have the no visitation for their. So what does that really look like? So if somebody has a child and they go into the ER, can they go back with their child to be there, or how does that work?
Yeah, so I don't really want to speak to that policy since it's a hospital policy, and I'm not sure of the nuances of that. I can tell you what the health department has done when it comes to parent accompanying children or people entering our facility.
Sure.
Okay, cool. So kind of what that looks like is one parent can go with the child if they're underage. We screen everybody as they enter our building, do the temperature, ask them for symptoms. We have a nurse right up there at the front. And other than that one parent accompanying a child, there are no other people that go into your appointment with you. And so, I think that has been a method that just limits the number of people in the building, which is good because A, we don't want them to be coming in, risking spreading anything, and vice versa. Like, we don't want to risk spreading anything to them either. And
Sure.
that's kind of the measures that the health department has taken when you would come into our facilities. I'm not sure exactly what that looks like as a hospital policy, but I think it's awesome that they've taken precautions to limit the number of people in that building.
Comment in the chat room from Jamie Barry. How long does it take for the tests to come back when you're administering them?
It depends on what lab you go through, and that time has increased from 24 hours to 10 days. It depends. It depends on the lab. And so when we send in a test, we work with that individual who administered the test to ensure that they continue like precautionary measures. They continue to self-isolate while we wait for those test results, just so we can take any measure possible, even if that test is negative, to ensure that they're safe, to ensure that their family and the community is safe.
Megan Carr in the chat says, what are the repercussions of non-compliance? Should we be reporting reckless behavior?
So a few things on that. I'm assuming she's talking about non-compliance with executive orders, so I'm going to be answering in that context. So when Governor Kelly issued her press release with the stay-at-home order, I think the first thing in this conversation that's important to talk about is that she made this big emphasis for people to govern themselves, to be responsible citizens who care for, as cheesy as it is, who care for the greater good, who care for our community, who do the most they can do for the good of our public health. And so I think that's a key piece, that we should be people who are governing ourselves and doing it well to care for our community. But the second piece of that is, it's kind of our stance that it's a state order and that enforcement comes through there. And so as Governor Kelly mentioned, like, there's no slip that you have to have proving you're an essential worker. Please don't call the hotline saying you saw so-and-so driving down the street and you don't think they're an essential worker. Really, the kind of enforcement piece coming from our end will be working on looking, those public gatherings. But I really think the key piece of enforcement and key piece around like that whole conversation is being awesome citizens. And, we love our community. And I think that when we want best for other people, that means giving up things we care about and giving up things we love. And, I love getting my coffee every morning and I love going out to eat with my friends or going to movies. But man, if it means keeping our community safe, I would give those things up in a heartbeat. I'd ask the rest of us in Finney County to do the same. And it sucks and it's hard, but it's going to be so worth it.
Yeah, I absolutely agree with you. Just having that time, when you look at it, this is a season that we're going through, not years, not looking at the long haul of everything. But if we can keep people safer, it's all worth it.
Right. And I think being so proactive on the front end of it and, really coming down on it hard right now is going to be that key piece. So we don't drag this on forever and ever and ever. Really, it's going to take action from every single person. And if we can do that, if we can come together, that's going to be the way for us to keep moving through this situation.
Sure, absolutely.
So I'm seeing some questions in our chat room about mail and Amazon packages and things like that. What's the recommendation for handling packages and mail? Should I Lysol everything as soon as I pick it up, or should I leave it out in the garage for a couple of days? What's the best practice there, Maggie?
Sure. Yeah. So like I said earlier, there are a lot of things that we don't know with coronavirus, and information changes so quickly. And so they're still in that research of what objects does it stay on, what surfaces does it stay on, what temperature does it stay on. And generally it's thought that it is most often spread by respiratory droplets, which is why that 6 feet is so key. And so it is, I mean, if you want to Lysol your mail, I don't think that's a bad idea. If you want to wipe it down, absolutely take precautionary measures because those were touched by other people and we don't know how long those things live on it. However, the currently most generally assumed way it is spread is through those respiratory droplets. So it's probably not as high risk as other areas.
During the town hall again on Tuesday, there were lots of comments about public places being open like the zoo. So when you're out on the Tally Trail, playgrounds, are those playgrounds, parks, are those still recommended by the CDC and KHD to go to? Should I take Clorox wipes with me when I go? What's kind of the general practice for that?
So in public places like the Tally Trail, that is awesome. Totally get out there and take a walk with the people who live in your home and enjoy that. And stay 6 feet apart from other people. If you see somebody walking, take the time to move to the other side of it. If you want to stop and say hi to somebody, stay that 6 feet apart. But Tally Trail is awesome. I think it was Live Well posted on Facebook today, like some little information piece about how to stay safe in parks. And really that's that key piece, keeping that 6 feet apart distance and then not going on walks or outside with people who don't live in your immediate home. You know, that's another way where you're spreading it. But when it comes to things like playing on playgrounds or, you know, walking around Walmart for fun, things like that, like don't go play on playgrounds. Don't play on playground equipment. You should kill that time at home, in your yard, or on the walking trail 6 feet apart from other people. You should not be touching playground equipment. You should not be walking around Walmart for fun. You want to avoid touching those public surfaces.
Vera Orozco says, after someone is diagnosed with COVID-19, how soon do you contact? And I'm guessing with limited manpower, how quickly does one of those investigations move?
Yeah, so the contacts with those contacts happens as quickly as possible. You know, when we get a new positive, that is right when our disease investigation team goes to work. And so those contacts should be expecting calls. I don't want to say immediately because that's not how it works, but immediately. We take this very seriously, and KDHE has a protocol and a process for all of this, and it matters to us that the individual who is positive is quarantined, but also that we contact those people as fast as possible because we want to care for our community well.
This is a sort of a piggyback on the same thing. It says if someone can have it for 2 weeks and not know and show no symptoms, how do you find out who they came in contact with during those times?
Yeah, so a couple of things on that. One, I think that is why this stay-at-home order is so important. I probably sound like a broken record coming back to it, but like that is the truth of the matter, that people who aren't experiencing symptoms could be positive. Even people who are experiencing symptoms and who don't get a test could be positive. And I think that's why, you know, when we go through this case, the disease investigation, the fewer people we have to contact, the better, because it means more people are safe, but it also means that you were staying home and that you were taking those precautionary measures too. And so whether you're symptomatic or not, you should be doing that because you could never receive a positive result and be a carrier of it. But kind of the second piece of that is, you know, the disease investigation and protocol through KDHE is pretty thorough to the extent that it's a lot of questions. It's a lot of contact. It looks at things of what buildings have you been in, and you know, you can't track down every person in that building, but knowing that information from there, we can take measures to sanitize things and be precautionary when it comes to that aspect. But I think that question is just another reason why that staying at home piece is so important.
Yeah, piggybacking on that and social distancing, and I think you mentioned earlier, you know, don't go to Walmart or Home Depot to shop and walk around to do things. There was a report that came out by unicast.com and graded Finney County a D in terms of cell phone activity around non-essential businesses. How concerning is it to see that? Is that something we can follow? I saw people make comments about the types of jobs that we have and the travel in between. those areas. How concerning is that for the medical community here in Garden City? Is that something that you guys look at when making decisions, or?
Yeah, so I'm not sure know exactly what the Unicast report said, but I did see something that was kind of tracking that same and gave that kind of same data. And I think that it's hard to speak to that in a rural setting, because from Holcomb to Dillon's is more than 2 miles. From my house in Garden City to Dillon's is more than 2 miles. And so I think that that is something to take into consideration when reading data like that. And the recommendation would be is that we would encourage everyone to do their best to adhere to social distancing policies and diminish all non-essential travel. And so, you know what? It's essential for me to go get my groceries from Dillon's or from Walmart once a week. But it's not essential for me to go walk around Target and have a good time as much as I do love Target. And so even though those places are 2 miles away, just because we are in a more rural area and you do have to travel farther to get places, the question you should be asking yourself when doing that is this essential or not? Because going to Dillon's to get your groceries is essential. You need that. And that's a trip worth taking. But to go gallivant around and have a good time around is less essential. And so it would not be worth it in that regards to take that
What
time.
do you say
and so I think that.
Oh, go ahead. I'm sorry.
Sorry. Oh, you cut out. What's up?
Oh, I said go ahead. I have a question after you. You go ahead and finish what you were saying.
Oh, I think I was just going to continue to elaborate, but I think
I guess
I think
I'll edit that awkward part that I just made on the show out. Let me ask you this: we all want to be patronizing these restaurants that we enjoy. We don't want to see them go under. Is it a risk in itself eating out? Like, and not maybe. I know that they are saying that it's not really being transferred in food, but I mean, you have to deal with like the bag they put it in, the wrapper they put it in. Like, these are being touched and breathed on by people that are just trying to make a living. Like, should we be leery about eating out, or?
Yeah, sure. I think those are all questions that people have to ask and make those decisions for themselves. And I think it's awesome to support businesses like that. Like, you're right. I have a lot of local businesses in Garden that I care about and restaurants that are amazing that I want to see come through this. And so I love the fact that we can support them in this time. And so I think when you are ordering out, I think like doing the delivery, doing the to-go, waiting in your car to pick up things. If you're restaurant workers, wearing gloves, limiting your contact with people you're delivering to. I think those are all like precautionary measures that would apply to this instance as well. The KDHE has some awesome toolkits that are linked via the Finney County website where you can go find them that would give recommendations for those kinds of things. So if you're a restaurant worker or owner, there are things that you can do to further protect the people in the community. But I love that we have people in the community who are supporting these restaurants. I think that the precautions of ordering to go and like washing your hands then before you eat your meal would be key things to consider when doing that.
Who's next?
Yeah.
Ken's reading.
No. Well, I think
we didn't go through the slide with the confirmed case. Did you want to cover that?
Well, yeah, so we're starting to see, with more testing going on in Garden City, as limited as it is, we're starting to see more cases rise. A lot of people are being told just to go home and self-quarantine because they don't meet all of the standards to get a test. A bit about exactly what self-quarantining is. And do I have to cut myself off completely from my family, stay in my own room? Can I hang out with family? What's the recommendations there?
Yeah, so there are kind of a few different things to consider in that conversation. So there's a difference between social distancing, quarantining, and isolating, right? So social distancing is people who don't know that they've been exposed to the disease and take these actions as precautionary measures, which is what we should all be doing. You should be social distancing when you go to Walmart and try to stay 6 feet away. And then quarantining is for people who don't have symptoms but were exposed. So we would be like those contacts. And then that isolation is people who have had a confirmed positive who are already sick with the disease. And so those are kind of what KDHE identifies as different things, and each of them have different aspects that go with it. So when you are isolating yourself at home, if you are told that you have symptoms but you don't meet criteria and you should go home and self-isolate, that looks like this. You shouldn't be leaving your home unless you're in an emergency situation. You should be, if possible, have somebody else go get your groceries from the store to you, have a friend drop them off on your porch and leave them there. You should avoid one-on-one interaction within that 6 feet of other people, like everybody should be doing. You'd be given instructions when you call the hotline, and we would tell you to monitor your symptoms, to, if possible, be taking your fever once to twice a day and be writing that down, and watching for if your cough gets worse, or if you start to have trouble breathing, and if you do have that medical situation where you're in an emergency and you can't breathe to that extent, to call 911. Things like that. Continuing to clean those surfaces. You be advised, if possible, to use a different bathroom than other people in your household. Just kind of things like that. And so when people call the hotline with those, we have our nurses who are able to give you advice based on that and based on your symptoms. Like, if you're just experiencing allergies, but you're afraid because this is a crazy time we're living in, they can give you those recommendations too. But if you're somebody who doesn't call the hotline and you're experiencing symptoms, or you're not feeling well, I would tell you, one, call the hotline, because we have great people standing by who want to talk to you about that. But two, to stay home and monitor those symptoms and continue to track them and see if they get worse.
So I'm assuming, go ahead, Janene.
I was just going to ask, I'm just curious, do you have any idea how many calls that you guys have had to the hotline? Is that tracked anywhere? Or?
Yeah, we're tracking that data. I don't have that number. Fortunately, that is something that is not my job to keep track of, which I love. But, like we were talking about earlier, man, that phone is swamped all the time. I think we have 3 lines open at the health department. So we have 3 nurses working that phone line, and it is always busy. And so I think that's awesome that we have people in the community calling about their symptoms. And that's kind of where we want to, what we want to keep the focus of the hotline as. When you call that number, you will be prompted to either press 1, where you'll listen to a pre-recorded message that we update daily with a total case count and some general health recommendations in English and Spanish. Then pressing 2 gets you to that live nurse where she can screen your symptoms. And then we're asking for people who have all other questions, such as, we've had a lot of things come up with, am I an essential business or not? To find that resource on the KDHE website or via the Finney County website. We've got all that there for you. We've got the forms you need to submit to the state government to determine if you're an essential business or not. We've got facts and myths. We've got, and so we really want to keep that hotline for the people who are symptomatic, as opposed to people asking the questions about essential businesses or people telling on people, and really keep that open for that. Like that's our focus there, especially since we have so many other places where you can get that other information.
Sure. You said something that was really interesting. I know that you said that the first part of that hotline gives you an option to be able to see how many cases we currently have here. I noticed on the press release today on, the number of cases that we have with the 5 cases that it said that would be the last release that came out notifying. Where do people go to get that information then? Do they look on the website? Do they?
Yes, we have, we're kind of taking the lead off of other counties in Kansas once the numbers start ticking up, because we do anticipate more positive cases. To find it on the finneycounty.org/coronavirus. We'll have a tracker that is going to be continually updated with each new case. And we'll be sharing that website out throughout as well, because we do want people to have access to it. It's not we're trying to hide, and we don't want people to know that there are positive cases, because we do want you to know that there are positive cases, and this is real in Finney County. But that place is going to be your home base for all of the information. So finneycounty.org/coronavirus.
Do you know how many ventilators our hospital has?
You know, I used to know that number, but they've been continually creating more and making more rooms that are capable of having that. And so I think that's an awesome move to be making. But the reality is we serve a huge population, not only people in Finney County, but in surrounding counties, because we are equipped and that size to do that. And so, you know, I know that's been a concern across the country. Do we have enough ventilators? Are our hospitals equipped? Which is why those stay-at-home orders are so important. I mean, even in that like clip that you played from Governor Kelly, you know, talking about we don't want to overwhelm our hospitals, and that's true. And so, yeah, I don't have that number. That would be a hospital question.
I'm seeing in the comment section, it's around 20 ventilators at the hospital, which is a pretty low number considering the area that we do service. Are we looking at using other buildings like terrace gardens, rest homes that are empty now to expand on that? Is there any help coming from the state to get more out this way to service Western Kansas and Finney County, or from the federal government? What's that look like currently? Because I know states are bidding against each other, and so how are we doing with PPE and supplies like that, and ventilators?
Yeah. So our emergency management team is headed that up and making contingencies and bringing in all of the necessary parties for those conversations. And so considering what does our overflow need to look like, what happens if we run out of PPE, all of those conversations are being had by the emergency management department. The second thing of that is there is some federal and state help when it comes to acquiring more PPE. And so we've submitted those requests, and that's kind of something that we're hoping comes down the pipeline. But yeah, there is help, and that has been requested and is in the process of working through going through the emergency management department at Finney County.
So you mentioned earlier that the health department and the hospital have partnered up together, and they're working really well with the phone calls and things. Are you guys doing more together just outside of the phone calls and sharing that information with the city? Like who gets together, makes decisions about the zoo being closed down, for instance?
Sure. So there's a couple levels of that. The first is that as the public health entity, Finney County Health Department is making recommendations. And really with both the orders from Governor Kelly and the health recommendations we give, we're kind of putting that into the hands of the leaders to make the best decisions for their organizations and their community. And so the decision to close the zoo would have been a decision made by the city based on the information that they had, and that they made that decision. And so there are very open lines of communication with both us in St. Catharines and other entities across the county. From the get-go, we realized that the communication piece would be very key in this, in getting people the resources they needed, getting people the information they needed, and teaching them how to deploy that in a manner that was effective and could reach people. And so Sarah McClure and I identified kind of just this list of people who needed to be receiving this information, who could then pass it on, like this message tree. And so, and it's continually growing. And we're really grateful for the people who immediately jumped in with us on that, who said, we're willing to take that, and we're going to go share it with these people. We have the chamber as our business contact, who then can share it with the businesses in the chamber and other businesses in Garden City and Finney County. And so that's kind of been one of our huge methods for getting that information out, all the resources from the press releases to posters to social media packages to fact sheets and things like that. And so that's been one aspect of our communication. And then we have a lot of internal communication that's happened. It's been such a collaborative effort, which has been really cool to see. Just how all of these different departments come together, and how the health department works really well with the emergency management department, and how everybody is out having conversations with leaders in nursing homes and at the hospital and the school district. And really, it's so cool to see all of these different people from different organizations coming together in Finney County to best care for our people. And I love that we can bridge these gaps between private and public sector and the schools and the churches, and really rally around this one cause of doing our best to keep people safe.
I agree with you 100%. Finney County is one of those places that's always been known for that, being able to work very closely together and bridge those gaps and collaborate on different things. And so seeing that happening with this situation and with the COVID-19 piece here has just been a phenomenal, it's very reassuring to know that there are so many people that are caring and working on it and knowledgeable, that looking at what's best for our community.
Yeah, absolutely.
So a couple more questions and we'll let you go, Maggie. It's been a little over an hour and we thank you for being here tonight. Got some really good information to share with the public here. So you said earlier that you can call down to the health department for all sorts of resources. So we're seeing unemployment go up right now for furloughed employees and even people that are employed without health insurance. What type of coverage is being offered for people without health insurance? What do they need to do, or where should they go? Websites, things like that.
Sure. So two things on that. The first is, I don't know how much I can speak to that, simply because that feels more like an insurance industry question rather than in my area of the health department. But the second aspect of that is we have a lot of community organizations and volunteers standing by who want to help. And if you go to that same website, finneycounty.org/coronavirus, you're going to find people to contact for that. We've got the United Way and Salvation Army who want to help with food and who have volunteers who'd happily deliver that food to your house. We have our WIC program housed in the health department, and depending on what you're eligible for, you can be receiving food for infants and children. We have the school district providing food for kids, and so I think we have and churches stepping up in big ways to care for people too. And so you can head to that website and find some of those resources there. But really, any of those community resources would be great places to look for help. And we are collaborating with them to ensure that volunteers are kept safe and that all KDC guidelines continue to be met while people are fed and kept in their homes and things like that.
Are we doing anything to help out other states like New York? I know they're asking for med staff to come in and help them out while they're dealing with the struggle. Are we doing anything like that here in Finney County to help, or are we trying to get more staff to come in for the uptick that we're going to see?
Yeah, at this time we're not really sending resources to other places, but we are collaborating across sectors to have others come in and help where they can, whether that is working the phone lines or screening people with temperatures as they come in the building. So things like that. That's kind of where the focus is when it comes to people and volunteers and helping out. And so we've had people step in and do that too. If you are a medical professional or really somebody who wants to come help out at the health department, you can call the health department 620-272-3600 and speak to a receptionist. And we've got a list going that is growing and has people on it who want to come in and want to help and volunteer their time to help us combat this in Finney County. And so if you're somebody who wants to help in that regard, you can contact the health department, and we would love to work to find a place for you as we need it.
Final comment of the night. I'm not sure if you can comment on it. They're wondering if it's been announced how many of the 5 confirmed are hospitalized and if anybody's recovered.
Yeah, so I can't answer that question. I can tell you that we are working with those people to ensure that all KDHE protocol and mandates are met. And so, yeah, that is the extent to which I can comment on that.
A couple people says, thank you, Maggie. You're extremely knowledgeable.
Thanks, Maggie.
And Chris Payne wants to know, can Maggie share with us how she became so awesome?
Can Chris share with us how he became so awesome? I don't know. I learned from the best, right, Chris?
Awesome. Well, Maggie, thank you so much for stopping by again. Hopefully we can check in with you in a couple of weeks and just get an update and see what we can do to help you guys out down there. Thank you so much for your service to our community.
Thanks for your time, guys.
Thanks
for all you're doing.
Well, all right, guys. On Sunday show, we'll welcome Cecilia Douglas, Grant Development Manager at Kansas Children's Service League. April is Child Abuse Prevention Month. So many of our nonprofit organizations are coming together to spread awareness. So she'll be here to talk about that. They are asking that everybody wears blue tomorrow and post it on social media using hashtags like hashtag Great Childhoods, hashtag Cap Month, and hashtag Wear Blue. Also stopping by is Shauna Whitehurst-Dill from Centura Health. She'll be stopping by to talk about the 200 pizzas Domino's is delivering over the next couple of weeks or 6 weeks, and masks that have been donated to Centura Health from the Garden City Co-op and other donations that they need at our hospital. Again, thank you to Maggie Unruh and Finney County Health Department for letting her stop by. We'll look forward to seeing you guys on Sunday. Have a great evening.
Bye, everyone. Thank you.
Well, I don't think it, I thought it, that's different. I said what I said and I meant it, or lamented. Words given weight without thought in a person, the way that I talk and the way that I ought to be able to pause and to say that the fault can be placed on my arms. To this playful assault, to disgrace in this arm. Pray for the day they could wait for the calm. You can't control the storm, only weather it. Whether it's 5 weeks and 5 days of rain sideways, or scorched earth, search for death or water left with